Hello, this is Bill Zoller with the Wellness Warriors Ministry, and today we're going to be discussing actually a continued discussion about fibromyalgia and chronic fatigue syndrome. In our first video on this topic, we ended with some discussion about aspartame and its contribution or possible contribution to these conditions. Today we want to continue with some information. Part of it will be about food, some about exercise, some about medications, and so on. So to begin, let's ask the question, why is it that plant-based diets help with chronic pain conditions like fibromyalgia? Why is that? Well, one of the reasons is because of a toxic compound called NEU5GC. NEU5GC is the name of the compound. It leads to chronic inflammation and the formation of antibodies, which can then lead back to even more inflammation. It is not found in plants. It is found in animal foods. And scientists have discovered, as they study cancerous tissues, that this abnormal sugar or sugar-like molecule is found in some of these tumors. And one of these is this NEU5GC, sialic acid. So a pure vegetarian diet, which would really mean nothing with animal food in it, including no dairy, would indicate, according to the research that we have, to be quite beneficial for fibromyalgia and chronic fatigue syndrome. Also, in the care of the person with these conditions, we need to look at food sensitivities and address that and eliminate foods that they are sensitive to. We need to keep vegetable oils to a bare minimum. Vegetable oils used in cooking and salads and so on to a bare minimum, because this can improve the immune function. Many people feel much better as a result of doing that. Now, a couple of words about malic acid and magnesium. Malic acid is found in apples. Remember, an apple a day, a lot of truth to that. This malic acid is an alpha hydroxy acid. It is also sold in a dietary food supplement. In alternative medicine, malic acid is used to improve athletic endurance, and so many people believe that it can help fight off the fatigue that we see in fibromyalgia and chronic fatigue syndrome. Magnesium, along with malic acid, can greatly improve energy and decrease fatigue. The recommended doses of magnesium for this purpose would be about 150 to 300 milligrams twice a day, and the malic acid dose would be about 400 to 800 milligrams 3 times daily. A 1991 British study found that magnesium was useful in chronic fatigue syndrome, improving energy levels and reducing pain by 80% of the people in the study. The study used an injectable form of magnesium twice weekly. They used an injectable form of magnesium weekly for 6 weeks, but you can also take magnesium orally. A diet high in antioxidants is recommended because these foods fight free radicals which cause inflammation. So a diet high in antioxidants is clearly recommended. Consume foods like almonds, apricots, asparagus, bell pepper, blueberries, broccoli, brown rice, cabbage, cantaloupe, carrots, cauliflower, strawberries, sweet potatoes, tomatoes, watermelon, and etc. All these are my favorite foods. The best science to date suggests a plant-based diet in its many variations may help people with fibromyalgia. Again, brown rice, cooked or dried fruits like cherries, cranberries, pears, prunes, but not using citrus fruits. Citrus fruits seem to be contraindicated with these conditions. Also, it is good to eat cooked green, yellow, and orange vegetables, and for drinking plain or carbonated water is the best thing. So here's some foods that are safe from the standpoint of pain. In other words, they would help eliminate or prevent pain. And one of them is a plant called feverfew, F-E-V-E-R-F-E-W, feverfew. It eliminates about 1/4 of all headaches. So it is an anti-migraine headache plant, and we would certainly recommend that. Ginger, the spice ginger, blocks histamine and also inhibits prostaglandins, chemicals that play a role in inflammation. And so it would be worthwhile to try ginger for preventing migraines. Ginger and some of the other related spices have great multiple benefits in our diet. So triggers for headaches, things that may cause or trigger headaches, include meat, dairy products, and eggs, chocolate, citrus fruits, wheat, nuts including peanuts, tomatoes, onions, corn, apples, bananas. When we say meat, that includes pork, beef, chicken, turkey, and fish. Interesting study. Adolescents with chronic fatigue syndrome tended to have low blood pressure, so they started these people on a high sodium, high salt diet to raise their blood pressure, and found that in many cases it led to dramatic improvement of their fibromyalgia symptoms. Amazing. Studies of healthy people have shown that those who exercise frequently, 6 hours or more a week, have dramatically reduced sensitivity to pain. Exercise activates the body's endorphins, natural chemicals that are part of the internal pain control system. Fibromyalgia patients feel much better when they get regular and vigorous aerobic exercise, such as bicycling, running, or step aerobics. The keys are frequency and vigorousness. It is important to gradually increase the exercise regimen and to also individualize this and stay within your individual limits. Many people with chronic fatigue syndrome avoid exercise, finding that they easily become worn out and even incapacitated by the exertion. However, if they start with brief, simple exercises and gradually work their way up to longer periods of time, they often feel better and have more energy. 1997 article in the British Medical Journal showed that patients with chronic fatigue syndrome, if they start out slowly with just 5 to 15 minutes of walking 5 days a week, they begin to tolerate it quite well. After this 12-week study, more than half the exercising patients reported feeling substantially better, and the benefits continued a year later. 63% of the participants were doing much better after a year. Many fibromyalgia symptoms could be explained by a lack of a brain chemical called serotonin. This brain chemical helps to suppress pain. Serotonin is also important for regulating moods, which could explain why depression hits about 40% of people with fibromyalgia and plays an important role in our sleep, which is also often disturbed with fibromyalgia. Serotonin is made from tryptophan, which is one of the amino acid building blocks of proteins. When researchers test the blood of people with fibromyalgia, they often find low levels of tryptophan. Foods that are high in carbohydrates like breads, pasta, potatoes, and fruits can increase the serotonin in the brain. So high carbohydrate foods, they also increase a second brain chemical called norepinephrine, which is also important in pain control and moods. Now, just a couple of comments about essential oils. Essential oils like whole plant foods and some sea vegetables and so on are one of the ways that we can derive these wonderful plant phytonutrients and get those in our diet. So essential oils. The first one is basil. Basil oil has been found to have some positive effect for migraine headaches and fatigue. Secondly, peppermint oil. Those of you who use essential oils, you'll understand this formula. So it is taken for aches and pains and tension, physical muscle tension. So it would be used with 4 drops of the carrier oil together with 1 or 2 drops of peppermint oil, and gently combined and then rubbed on the back of the neck. And it has been found to have some favorable effect in many cases. Next, I just wanted to briefly mention antidepressant medications, including tricyclic antidepressants, are routinely prescribed for fibromyalgia. They can help, but they are not a complete answer. Also, some doctors prescribe some anti-inflammatory drugs that can help for headaches and muscle and joint pains. So we hope that this information on these 2 videos is helpful for those of you who suffer from fibromyalgia and chronic fatigue syndrome. A very interesting conditions with many details that I think we can benefit from knowing about. So thank you for being with us today.